So can you introduce yourself first?
Okay, my name is Sweta Padala, and I work as a dental officer with New South Wales Health in Goulburn Community Dental Clinic in Australia. So I work basically in the public sector, and so it's linked with the Goulburn-based hospital, and I'm involved in providing general dental and emergency dental services for eligible patients in the Goulburn-Mulwari region. I have over 10 years of experience as I graduated in 2011, and I have been practicing in Australia since 2015. Yeah, I've had to do my registration exam. So I graduated from the Tamil Nadu Dr. MGR Medical University in India, where I obtained my bachelor's in dental surgery. And I've done my registration exams to be eligible to practice as a dental practitioner in Australia.
Okay, perfect. So, what was the average age range that you would see whenever, like, when you were working in the dental office?
Okay, so there isn't an average age range.
You saw every age.
Yeah, so usually I provide dental services for most adults over the age of 18, and and mostly pensioners and concession card holders. So it's usually for patients who receive Centrelink benefits, and those are the clientele that are eligible to receive free dental service through the clinic where I work at. So I do see some older age Australians who are retirees, but also see a wide range of young adults ranging from 18, so it's widespread. Yeah.
Okay, cool. So, how do you balance your work life with your family life or personal life?
Okay. I think working as a dentist, it gives me sort of like a balance. So, it's good in a way that it doesn't have the stresses or overtime or, unearthly hours as, working as a medical practitioner, maybe. So, and I work Monday to Friday at the clinic. So I work full time and work only Monday to Friday from 8:30 to 5. So I feel that gives me, like adequate time to pursue my other, interests or spend time with my family over the weekends. Yeah, and I try to keep myself active. I do like listening to audiobooks or, listening to music or, yeah, or doing some hobbies just to keep myself sane.
Was there any other field in medicine that you ever wanted to be in before dentistry, or did you immediately want to be a dentist?
Uh, I knew I always wanted to be in health science. If not for being, I would have wanted to, practice as, a doctor or a general. The medical training would have been too stressful for me, so I was glad that I, became a dentist. No regrets about that.
Okay. Did you want to know anything before you entered your education, like your training for dentistry, or did you just or do you wish, or do you think you entered in fine?
Um, I did ask a few people that were doing the course,
Mhm.
and I think it was also, well, I had a good dental experience, so I sort of like knew, okay, it wasn't a bad field to be working in. So, like,
Mhm.
although I should say, like when I was entering dental school, I probably didn't have an entire idea of what, you know, life would entail, but I think it certainly, I would have helped to know a bit better, but yeah, I wasn't totally ignorant, I should say.
Okay. So, how was your daily work life impacted by COVID? Like, how was it before and how is it like after?
Okay, so there was two parts to it. So at the beginning of COVID, so March 2020, I was working as a general dental officer, and again just providing emergency and general dental services to patients. So at the start of the pandemic, when restrictions started lining up, we had to shut down and only practice providing emergency dental services. So because our field is one that creates a lot of aerosol, it's one of the few fields where you are in direct contact and less than 30 centimeters from the patient. So you can't really like maintain a social distancing in a dental setting. So, and there was a high risk of actually spreading, getting COVID from the patients. But I think one good thing about dentistry is, irrespective of whether there's a pandemic or not, we still have like high levels of infection control that we have to maintain. We did have to take a few more precautions, such as using preoperative mouth rinses, so that it sort of like helps kill the COVID virus particles. So this was usually with hydrogen peroxide or chlorhexidine mouthwashes. So you do it for 30 seconds just before starting procedure. And then you had to always be wearing surgical mask at all times in the clinic. We still do. And luckily for me, I worked for 2 months afterwards, and at the end of May 2020, I was on maternity leave, so I wasn't working for a while. And I started back at work in March 2021, by which time there was an easing of restrictions. So we were seeing, like business as usual, sort of, but we still had to like maintain infection control. So wearing masks, wearing your full PPE, and if you were doing anything that was let's say if it was a patient who was symptomatic, you'd have to wear your N95 masks and shields and personal protective equipment that was appropriate. Since then, again, we've had two lockdowns, one big lockdown, and now it's sort of like ease restrictions, but because we work with health, we're still on red alert, which means, again, it's only like ensuring that we have to do a risk assessment. So anyone that's like, like symptomatic for COVID, if they're not an emergency, you're not treating them, and making sure you have checks and balances to ensure that people who are presenting to the clinic are fully vaccinated, and staff who are working are having had the boosters, and keep on top with vaccination requirements.
Okay. So, also, what is the average amount of patients you see in a day?
So my average amount would vary anywhere between 10 to 12 patients a day.
Okay.
Yeah, depends on the procedure, but on an average, it's about 40 minutes of treatment time per patient. And I work 8 hours a day. So yeah, roughly equates to about 10 to 12 patients.
Okay. So, what are some of your hobbies outside of outside of being a dentist?
Okay. Outside of being a dentist, I do like baking. I know it's a bit of a conundrum because yes, sweet food does increase risk of caries, but no, I do like my baking. Apart from that, I also like doing a bit of photography, which I frankly haven't been doing much of it. Although during this lockdown, when we had a bit of a lull in patients, I did take up crocheting as a new hobby. So yeah. So
Awesome.
that's just something I do. Yeah, and listening to audiobooks. So I do have an hour of commute each way, like 2 hours of commute each day. So I put an audiobook on and, listen while I drive.
Perfect, perfect. And
Mhm.
lastly, do you have any advice for the students that are going to be watching us?
Yes, I think, dentistry is definitely an awesome field to work in. It's sort of like, it's quite challenging at times, but it also gives you a sense of satisfaction because um, you get to do a lot of fun stuff. It's no 2 days are the same, and you get immense work satisfaction. Dental caries actually is one of the five most fifth most common cause of hospital admissions to a health setting. And to know that actually these causes can be preventable is, it's huge because, there's when a patient presents to the clinic with toothache, and when you actually administer pain relief and get them out of the pain while providing emergency dental treatment, um, patients are so grateful because it feels like, when they are in constant pain, it's about like they haven't slept for, a couple of nights, you're tensed, you can't function, and basically you're like lost. So when you provide immediate relief, it feels like, the patient's quite thankful. So you do get, the feeling of accomplishment. So it's definitely a wonderful field to work in. And you also, you don't have unearthly hours, which for me, I think is like a huge plus.
Yeah. Well, thank you
Yeah,
so much for this interview
you're welcome.
and have a great day. Thank you.
You too.